Hey guys, this is Dr. Sharanya Reddy. Welcome to my channel Dentistry in Detail, where you can learn dentistry from basics and build strong base in the subject. In the previous video, we learned about Norma verticalis. Now let us move on to Norma occipitalis. In Norma occipitalis, we are going to study the posterior view of the skull. This is how the skull going to look from the posterior aspect. Coming to the shape, it is convex. You can see here it is convex upwards, and below it is flattened. So it is convex upwards and below it is flattened. Coming to the bones, we already know that these two are the parietal bones and this is the occipital bone, and we can see here this part, one more part. This is the mastoid part of the temporal bone, and also we can see the this is the upper part of the parietal bone. So we can see upper part of the parietal bone above, and this is the squamous part of the occipital bone. So we can see the upper part of the parietal bone above, squamous part of the occipital bone below, and mastoid part of the temporal bone on each side. So what is the squamous part of the occipital bone? If we observe the base of the skull, that is at the inferior aspect of the skull, we can find here one large opening. That large opening is known as foramen magnum. So surrounding this foramen magnum, we can see occipital bone, that is anterior to the foramen magnum, posterior to the foramen magnum, and lateral to the foramen magnum. We can find the occipital bone. So whatever occipital bone that is present anterior to the foramen magnum, we call it as the basilar part of the occipital bone, and that is present lateral to the foramen magnum as the condylar or the lateral part of the occipital bone, and the occipital bone that is present behind the foramen magnum, that we call it as squamous part of the squamous part of the occipital bone. So that's why we are saying whatever occipital bone we are seeing from the posterior view is squamous part of the occipital bone. So bones we can see are posterior parts of the parietal bone above, and upper part of the squamous part of the occipital bone below, and mastoid part of the temporal bone on each side. Now coming to the sutures, we already learned that this is the sagittal suture between the two parietal bones, and this is the lambdoid suture between the occipital bone and parietal bone. And we can also find two more sutures. This is the suture present between the occipital bone and the mastoid part of the temporal bone. So this is the occipito-mastoid suture. And the one more suture is present between the parietal bone and the mastoid part of the temporal. This is known as parieto-mastoid suture. So from posterior view, we can find posterior part of the sagittal suture, lambdoid suture between the occipital and the parietal bones, and parieto-mastoid suture between the parietal bone and mastoid part of the temporal bone, and occipito-mastoid suture between the occipital bone and mastoid part of the temporal bone. Now coming to the other structures that are present, we already studied that the meeting point of the sagittal suture and the lambdoid suture is known as lambda. So we are going to see lambda in the posterior aspect also. And in front of the lambda, that is from 2.5 to 4 centimeters, in front of the lambda you can find two openings which are known as the parietal foramina. And the point on the sagittal suture between the two parietal foramina you find obelion. We already studied about these three in the Norma verticalis. We find one median prominence in this lower part of the Norma occipitalis. This is known as external occipital protuberance. And we find some lines passing laterally from the external occipital protuberance, and these are nothing but the curved bony ridges which are known as superior nuchal lines. And 1 centimeters above the superior nuchal lines, one more set of the lines begin from the upper part of the external occipital protuberance, and these are more curved than the superior nuchal lines, and these are known as the highest nuchal lines. And remember that these highest nuchal lines are not always present. They are present occasionally. And similarly, below the superior nuchal lines you can also find the flatter lines known as the inferior nuchal lines. And near to the occipitomastoid suture, this is the suture present between the occipital bone and the mastoid part of the temporal bone. So between nearer to this occipitomastoid suture we find one opening that is known as mastoid foramen. Mastoid foramen is present on the mastoid part of the temporal bone nearer to the occipitomastoid suture. And similar to lambda, we can find one more point here where the three sutures are meeting. Occipitomastoid suture, parietomastoid suture and the lambdoid suture are meeting at this point, and this point is known as asterion. And apart from this, you can also find occasionally at the apex, this is the squamous part of the occipital bone. So at the apex of this squamous part of the occipital bone you can find the triangular bone which is known as interparietal bone or Inca bone, that is present occasionally. Actually it is the membranous part of the occipital bone that failed to fuse with the rest of the occipital bone. This is the median prominence on the lower part of the Norma occipitalis known as external occipital protuberance. If we observe the skull laterally, so here this is the medial prominence. This median prominence is known as external occipital protuberance. On this prominence also you can find, this is the external occipital protuberance. So on this external occipital protuberance you can find one more prominent point that is known as inion. And a little point above this inion is known as occipital point, and it is actually the farthest point from glabella. And what is glabella? This is actually, if you observe the skull from the front view, it is the median point at the level of the eyebrows. That median point at the level of the eyebrows is known as glabella, and this occipital point is farthest from the glabella. So guys, this completes Norma occipitalis. I hope you understood the topic. If you liked my video, give me a thumbs up and subscribe my channel so that you won't miss any of my videos. Have a nice day, guys.